Welcome to the webinar, Tag in Action, Sources of Strength, part of the Successful Strategies for Improving Adolescent Health webinar series sponsored by the HHS Office of Adolescent Health. This webinar is one of a series highlighting local, state, and national efforts to improve adolescent health and is part of a national call to action called Adolescent Health Think, Act, Grow, or TAG. My name is Emily Novick. I'm the Acting Director of the Division of Strategic Communications at the Office of Adolescent Health, or OAH. I'm very pleased to be with you to talk about TAG and to share information about a successful strategy to improve adolescent health. This webinar highlights an exciting program, Sources of Strength. Sources of Strength is a universal, peer leadership approach to preventing youth suicide, bullying, violence, and substance abuse. Today we're joined by Dan Adams, Director of Training at Sources of Strength. Before I turn it over to Dan, I'd like to provide you with an overview of OAH and TAG. The Office of Adolescent Health is located in the U.S. Department of Health and Human Services. OAH was first funded in 2010 and charged by Congress with developing a national plan for improving adolescent health. OAH has used its limited resources and the input of experts to synthesize what we know about what works and to spur action in support of adolescent health. The TAG call to action is a first response to that charge. With this webinar, we're pleased to share an example of a youth-serving program that takes what they describe as a radically positive, strengths-based approach, an approach that you will see is very much in line with TAG. TAG builds on the collective work and insights of many professionals, researchers, and family members who know what it takes to promote the health and healthy development of America's 42 million adolescents. Teens are generally fairly healthy, yet there are many missed opportunities to promote adolescent health and to intervene promptly as challenging health issues emerge in adolescence and young adulthood. TAG is a comprehensive, strengths-based, positive youth development approach to adolescent health, rather than a risk-based approach. TAG is designed to help young people reach their full potential as healthy, productive adults. With TAG, we hope to spur action across multiple groups of professionals and organizations and in communities that all share a common interest in promoting adolescent health. Stakeholder engagement is a core tenet that drives all aspects of TAG and reflects our understanding that many determinants of adolescent health lie outside the healthcare system. The goals for TAG are the following: raise awareness about the importance of adolescent health, engage stakeholders such as youth-serving organizations and caring adults, get adolescent health on the national agenda, and spur action. Long-term, TAG contributes to achieving the Healthy People 2020 objectives for adolescent health developed by HHS. More details about TAG and the 5 essentials for healthy adolescents can be found on the OAH website. Before we begin, I'd like to point out that the content and views in this next portion of the webinar do not necessarily represent the official policies of the Office of Adolescent Health or of HHS. I'm now pleased to turn things over to Dan to learn more about Sources of Strength and its impact on young people.
Hi, I'm Dan Adams, Director of Training for Source of Strength. And Source of Strength got its start up in North Dakota. Mark Lomery was our founder and director and started implementing Source of Strength in the state of North Dakota, and it has spread more widely across the United States and across the world, now moving internationally. So I'm happy to be here today and share a little bit about what we do with Source of Strength, some of our success, and a bit about our model. Source of Strength is what we call a strength-based upstream suicide prevention program, and we have an evidence base in suicide prevention, although we really are designed to be more of a wellness model, mental health promotion. And let me unpack what I mean by upstream prevention for those that might not be familiar with the terminology. There's a common parable in the mental health field that's used widely, and we use it in a particular way. If you can imagine a river that flows through a valley and then over a waterfall, and near that waterfall's edge is a village, and there's a woman who lives in the village, and takes a daily walk along the river's edge. And as she's walking one day, she hears a young person caught up in the stream about to go over the waterfall. And so she dives into action, jumps into the river, swims out, grabs the young person, brings them back to shore, and performs CPR, saves a life. The whole village celebrates this heroic event and saving a life. But day after day, there's more and more young people caught up in the stream about to go over the waterfall. So they jump into action and they build watchtowers and they develop an infrastructure and they train lifeguards and life-saving techniques. They're able to save a lot of people, but they're not able to save everyone. And so, burdened by this reality that they continue to lose people, either at night and they can't be seen, or they're under the surface of the water and they can't be identified, this original woman starts to walk upstream and everybody says, "Hey, where are you going? We need all hands on deck. We can't spare you. You started this project." And she says, "I'm going to go see if we can't prevent some young people from falling in the river in the first place. Or can we move some of our efforts from the waterfall's edge further upstream to build some fences around the river, or to develop some protective factors, to have adults hanging out further up the stream to pull young people out, or some signs saying that there's a river nearby and don't get too close to the edge or you'll fall in? Or can we train young people with the skills that when they do fall in, they can swim to the shore and climb out themselves before they reach the rapids or that waterfall moment, so while the water's still relatively tranquil?" And that's what we mean by upstream prevention with sources of strength. Our primary mission is to move as far upstream as possible, to build in protective factors into schools and communities, to talk about resilience and wellness and strength and coping mechanisms and trust towards adults and changing perceptions of adult support and perceptions of health-seeking behavior, so that we can prevent crisis further down the stream. And the reality is, as many of you all listening will be aware, that most of what we call prevention in the United States is really typically intervention. It's at that waterfall moment, particularly around suicide prevention. It's training adults in risk factors and warning signs and plugging them into the proper mental health referral process. And that's incredibly important work, and we need more of that. We need that in our schools and communities across the country. But we really feel that that's not enough. That we got to do better than simply just working at that intervention crisis moment. We need to move upstream. Source of strength does have a secondary benefit at that intervention level, in that our peer leaders are 4 times more likely to refer a suicidal friend to a trusted adult. So young people acting as connectors to help at that crisis moment, helping connect their friends to support and resources to get the help they need in that intervention moment. And at a third level, below that waterfall, in that post-vention space, we in the reality of a death or a loss of a young person or of anyone in our community, we know that schools and communities are really grieving and struggling to grapple with loss, and we really empower peer leaders to be connectors to help, eyes and ears on the ground, connect their friends who might be struggling to the resources they need. And it's also a time we need to be talking about strength. And what are the resiliency factors we're using to overcome this adversity? We know effective postvention is really effective prevention, and we can help shape how people recover and get through difficult times. So that's a really helpful image in terms of what we mean by upstream prevention. Another helpful philosophical image that we use to illustrate what we do with Source of Strength is around filling the gaps that we see in prevention that often limit the impact of really well-intentioned programs on the young people they serve. And one of those gaps is that a lot of prevention is risk-focused. We identify the risk factors or warning signs around a particular issue and target those who are at most at risk. And when it comes to suicide prevention, we've found that if you ask young people what the risk factors are for suicide, they can often list off a pretty thorough list. But if you ask them, how does someone get better? How do they get through that? How do they recover? There's often a shoulder shrug or, I don't know, see a counselor. And that might be one way, but if that's the only dialogue we have around recovery and strength, we feel that that's a significant gap. And so we believe really strongly that we need to have a strength-focused approach, not just seeing young people at a deficit, but what are the assets and strengths that they have? How can people tap into resilience and well-being to overcome difficult challenges, that they're not just at risk, but they're potential partners in coming up with solutions to issues that they face. So that's a major first gap that we fill. The second major gap that we see in the field is a lot of prevention is sad, shock, and trauma focused. Telling sad stories, shocking statistics, traumatic death stories. And while we know that might be effective with a portion of the population, amongst our most vulnerable students and staff and communities, it can often be triggering, make them walk away feeling more vulnerable than they were in the first place or less likely to seek help. There's a whole bunch of examples of that sad, shock, trauma approach, and we really believe that it's more effective, and our research has borne this out to be true, to talk about hope. How do people find hope, and how do they operationalize that and turn it into action, actionable goals and pathways towards agency? How do they talk about helpful resources, formal and informal? And let's talk about strength. To really counter narratives of sad, shock, trauma. And we know that to be much more effective, particularly amongst our most vulnerable students and those in our community. The third major gap we find is a lot of so-called youth suicide prevention, or youth prevention in particular, is adult-driven or largely adult-driven, of adults being trained, going out to do this work for young people. And we know that we really need peer leaders to be involved to have the kind of impact that we need to have, that they know much sooner when their friends are struggling, and they also have the capacity to speak into their friends' lives in ways that we don't as adults. And there's often codes of secrecy and silence that exist that can be a barrier for young people to tap into adult support. And so we need young people to help change and shift culture around help-seeking behaviors to really fill that gap. So that's some of the ways the Source of Strength is trying to shift the narrative and conversation around prevention in the United States and fill some pretty significant gaps that limit outcomes around programming. The basic model of Source of Strength then is bringing together a group of supportive, caring, connected, and positive adults, giving a training to them, teaming them up with a diverse group of peer leaders that represent every click and corner of a school and community, diversity in terms of race and religion and ethnicity and gender identity, sexual orientation, yes, but also the different kinds of cliques and social categories as students. And really the key being that they have influence and sway within their friendship groups. We do a training for them together with the adults as well, and gear them up to carry out a series of strategic messaging campaigns that get at engaging, interacting, and inviting people to apply strength, the 8 strengths from our Source of Strength wheel to their lives in interactive ways, and then spread those strengths across the school or community. And so the whole goal of teaming up adults, partnering them with diverse peer leaders to carry out strategic messaging campaigns is to achieve positive culture and climate change. Change the environment of a school or community to build on the good stuff they already have, the assets they have working, but to uncover those in particular ways that help build culture and climate around safe, engaging places where people can ask for help and reach out for help when they need it. And we do that through the methodology of positive social norming. That a lot of prevention is actually negative social norming. We talk specifically about the negative behavior that we're trying to prevent young people from engaging in, but unintentionally we can reinforce it in people's minds, and they can start to feel it is the norm, even though it's a false norm. It's not actually the majority of students or adults engaging in that behavior. So positive social norming takes the approach, say, let's focus on the positive pro-social behaviors and true norms that exist, and spend all of our time talking about them in a way that can help break down and limit the negative behaviors and occurrences of negative behaviors we see in populations we're working in. So that's the basic model of Sources of Strength, and all of it really centers around this wheel of strength. These 8 strengths that we know to be both from research, protective in young people's lives, but also from stories we hear from young people of ways in which they've overcome adversity, overcome suicidality or feeling suicidal, attempting suicide, overcome difficult experiences like bullying or harassment or sexual assault. These 8 strengths are really the stories that we hear of how people get better and how they get through it. And so real simply, family support, positive friends, mentors, healthy activities, generosity, spirituality, medical access, and mental health. But these 8 strengths are what wellness and health and well-being look like in young people's lives. We've tried to make it simple enough where young people can tell their stories through this lens. And so at its core, Source of Strength is really a storytelling process, with these 8 strengths being the vehicle for those stories to be told through lots of different mediums, wall displays, presentations, classroom activities, videos, social media campaigns, and school-wide activities that get at highlighting these stories and helping young people internalize them. So underneath some of the visual stuff, what we call the 5 engines of success of social strength are really the drivers of its effectiveness out in schools and communities. And the first engine of success that we view as part of the program is social networking theory. We use it both to research what we do as well as to operationalize how we spread norms across social networks of a school. And so if you can imagine the lived social networks that we engage in, to simplify, I have a 5th grade social network up here on the slide, and we know that things can spread across the social network, right? So each dot represents a person, each line represents a relationship. This 5th grade classroom was asked to name their 5 closest friends, and what we know is that if one kid shows up to this class with the flu, it can easily spread across that social network. It goes home with those kids to their families, and it might spread to people that don't even know these kids, the original kid that brought it into the classroom. And so we know that illness or disease can spread across the social network, multiple degrees of separation in that way. And the CDC has studied that for a number of years, but we're now learning that behaviors or norms like smoking, like body mass, like exercising behaviors, these things can spread across the social network, and the people we're connected to and the people that we're not even connected to have an impact on our behaviors and norms. And so social strength is flipping this on its head to say we can also see positive norms and behaviors spread across social networks. So things like help seeking, things like trust towards adults, things like resiliency and wellness and hope and help, and be contagious and spread across the network. And so we really view peer leaders once trained as these agents of social change, that they go out and are patient zero of an epidemic of health or a contagion of strength, spreading positive norms and behaviors across their network. And so where they exist in that network matters. We have some bridge students that easily move between lots of different groups in a school. They're great peer leaders and early adopters of innovation. We need some more central members, which are typically more popular students. Once they come on board and aren't just keeping the status quo, they can really have an impact amongst their social networks. We need more peripheral students that aren't as highly engaged with the network or as engaged with their school community, but they speak the language and have a common dialect with individuals on the periphery of the social network. And we need more isolated students that don't feel as connected to the social network. All of them bring an experience of life of what it means to walk into that school that needs to be turned into action to really have effect across the social network in terms of spreading positive norms and behaviors. And so if we look then more at a more complex high school social network, this is from one of our randomized controlled trials with the University of Rochester, Dr. Peter Weinman's group there. And they're mapping this particular high school, both the relationships and connections cut with data across students who named that they had been suicidal in the past 12 months, those are the yellow dots, or they attempted suicide in the past 12 months, those are the red dots. The dot gets darker in its color if they also have friends that have that same experience. And so the dark red dots are students that have not only attempted themselves, but have friends who attempted. And so what we see in the 40 different high schools that we've done this trial is often a clustering together of students with suicide attempts, often on the edge of the social network, in friendship groups where others have attempted suicide. And so to have an impact amongst that high-risk population, we could target those, but we might miss the others that are in other parts of the social network. And so we really need individuals from across that social network. If we just selected the individuals at the dense center of the social network, we're not going to be able to speak to those who are in those high-risk populations, right? Likewise, if we just use those individuals on the edge of the social network as peer leaders alone, we might spread some of those unhealthy norms or behaviors across the network. And so we really need individuals from across the social network that have had multiple experiences of life and from a lot of different directions within that high school or middle school or university. To take the SIGN network and cut it against ties to trusted adults and having sought help from trusted adults, the green dots represent that help-seeking behavior towards trusted adults. And this slide is validating that trusted adults are really the number one protective factor in young people's lives. So that A group up in the top corner, where we only had one student with suicidal ideation, has a high level of trusted adults, and they've sought help from those adults. Whereas the B down in the right-hand corner section, those individuals that had higher rates of suicide attempts have lower connections and lower instances of seeking help from adults. And so it's validating that having a trusted adult significantly lowers the rates of suicide attempts and suicidal ideation among students who have a place they could go to and who they would seek help from. We know that having a trusted adult allows a student to be 3.5 times less likely to attempt suicide. And so we really need to juice that protective factor up and spread it across the social network of a school so that we can help protect and lower risk. So let's real quickly kind of thinking about social networking theory and the way it impacts our program. A couple other drivers are positive psychology and helping young people shift the lens on what happiness looks like and what success looks like, and how they can really practice changing their lens on reality now so that they can live into well-being. We use an active learning model where we're moving around, getting up, playing games, and operationalizing these concepts in lived reality, not just teaching them theoretically. We use positive social norming to really shift the conversation towards the positive pro-social behaviors. All of that to get at internalized strength stories where young people are really allowing these stories to become part of their own self-narrative, part of who they are, and part of going forward. The way they deal with adversity is by tapping into these strengths. That's a quick overview of some of the drivers and philosophical pieces of the way we think about source of strength. We are very committed to our evidence base and research around the program. We've been very lucky to partner with a number of research institutions. And our initial randomized control trial that we ran and was published in the American Journal of Public Health was partnered with the University of Rochester. Dr. Peter Wyman and Dr. Hendricks Brown conducted this trial, and they found initially that amongst peer leaders, the program was successful in increasing healthy coping attitudes, building more connections with adults, allowing students to be more likely to seek help from trusted adults for suicidal friends. And we saw the largest gains amongst the least connected and most unhealthy peer leaders that came into the program. So really a rising tide lifts all boats, that those who took a chance on saw the greatest benefit. Amongst the wider school population, we saw increased help-seeking acceptability, so changing norms and behaviors around asking for help and lowering the threshold of what it means to ask for help. That is a sign of courage and bravery, not just a sign of weakness, or not some of the negative stigma that often occurs around help-seeking, that you're snitching on a friend, but really it's what good friends do for each other. We saw increased perceptions that adults could be helpful for suicidal peers, so really breaking down some of the perceptions that adults can't be helpful, or they might just complicate a friend's life, to shifting it towards they are helpful. I have gotten help. I've seen it helpful in my friends' lives. We saw the largest gains for students with a history of suicide attempts. That most at-risk population benefited the most, but the wider population was also able to benefit from the program. And that initial trial got us listed on NREP list, SAMHSA's National Registry of Evidence-Based Programs and Practices, as well as on FPRC's best practice list. And that kind of launched us into the national sphere. The key finding from that initial trial, we feel, was that the conclusion was Source of Strength is really the first suicide prevention program of its kind involving young people in enhancing, building protective factors that we know are associated with reducing risk around suicide, and doing that across an entire population, at the school population level, not just at the individual targeted level. That trial launched us into another series of other research partnerships. I won't go into them too much. You can see them here. One, we're at the end of a national peer leadership study in 40 different high schools, the largest peer leadership study on suicide prevention that we know of its kind. A number of other specific research trials, but I want to highlight the one at the bottom there, sexual violence prevention study we're engaged in here in Colorado in partnership with the Center for Disease Control and the Colorado Department of Public Health and Environment, with the primary investigators from the University of Rochester and the University of Florida. We're studying the shared risk and shared protective factor approach of sources of strength, in that many of these issues that often get siloed or broken into different pieces and have programs developed to target those individual issues, many of them share similar risk factors, interconnected risk factors, and similar protective factors, or interconnected to protective factors. And so this trial is really taking source of strength, which has an evidence base in suicide prevention, and testing it to see, can we have an impact on sexual violence prevention markers and bully harassment prevention markers? Can a shared protective factor approach impact multiple forms of violence and multiple issues in a way that might open up the field of prevention, allow schools to implement not multiple programs for multiple issues, but one comprehensive program that might impact multiple issues? With that said, there are a number of campaigns that we do that through, and schools and communities don't have to reinvent the wheel, but can take our templated campaigns off the shelf, put them into action in powerful ways, contextualized by peer leaders. So real quickly, just want to share, for others, some of the success of our program is really dependent on local partnerships, developing collaborative action and mission and language with each other, the key committed adults in schools and communities that think strategically, have relationships with young people, and turn that into action, the diverse peer leaders that really are the core of what we do, connecting to help, becoming agents of change, and engineering positive norms in a community, and also the opportunity we've had to have research and develop an evidence base through partners, funding, and the fidelity of the program. So our advice for others listening to this that are out there doing good work in local areas and communities is to really, as you work and develop programs that impact young people, to have organizational humility that brings together collaborative efforts for multiple different sectors of people who are working together, to listen to the voices of youth and empower them to use that voice and have an impact in their own health and well-being, to really work hard on developing local partnerships and tapping into the assets and strengths that communities have, and also to research and evaluate what's working, what's not working, how can we shift what we are doing to have more impact upon young people. And then a few examples of what we do to close out. This, for example, pictures of trusted adults, young people naming trusted adults, creating wall displays that spread that as a social norm, lots of different creative ways that young people do that. Thankfulness challenges to talk about the gratitude we have and what's going well in our lives. Lots of different strength-based activities with the wheel, out doing parades in a community and engaging people. And then various different kind of strength-based campaigns. This one in particular is family support, and a chain of family support that wraps the whole school of students having named their trusted adults. And so thank you so much for having us. That's a quick feel of what Source of Strength is and what we're doing in communities, what we've learned, and what advice we have to share to others. So anyone who is interested in learning more about Source of Strength or getting in touch with us, please go to our website, sourcesstrength.org, or you can contact me directly at dan@sourcesofstrength.org. We look forward to hearing from you and educating, sharing resources about how people can implement Source of Strength or learn from the things that we have implemented. So I want to hand it back off to Emily for a potential question and answer period.
Thank you, Dan, for sharing your story with us, and more importantly, for your hard work and dedication in supporting young people in your community and across our country. We'd like to take a few minutes to ask some additional questions. In your presentation, you mentioned that Sources of Strength works to change the culture and climate of the entire school or the system where your programs operate. What challenges have you faced in your efforts to change entire systems, and how do you overcome those challenges?
That is a great question. Yeah, so some of the challenges we face is often not amongst peer leaders. We find young people are very eager to use their voice in powerful ways to make a change, but often the biggest challenges are getting adults to buy into a philosophy of social change, that the way the reality currently is, while we're dealing with complex issues and problems, it is possible if we put our heads together and think strategically to create social change in our schools and communities. And so we need adults that have the capacity, that have the skills, relationally and in terms of understanding trauma and the impact on young people and understanding motivation and youth empowerment. So often we face challenges where schools, staff, and systems are overburdened by testing and the requirements that they have to do, and not just showing up to work with their own wellness to be able to empower young people towards that. So a lot of our energies these days is also focused towards helping to train in source of strength, not only as content for young people, but we as human beings, as adults, we also need wellness and strength. And this model can be applicable there. So we started to develop workplace wellness and school staff trainings to talk about strength so that we can get to the level of the entire system being engaging in strength and wellness, and shifting their lens away from just what's not working or the sad shock trauma or the tough stuff in life towards what we all can do to make an impact in our school and community. So that's one of the major challenges that we faced over years, is how do we work within the whole system, and how do we gain access to administration, to the entire staff. Then how do we shift the needle in the conversations and stories that we tell at district level, statewide educational levels, and in our schools and communities beyond the walls of our schools. How do we shift the narrative to talking about strength? And Source of Strength doing that in a lot of fun and creative ways. We just had a school give a shout out to Hortonville High School in Wisconsin that ran a community-wide color run with 500 participants and 100 volunteers, in which they had lots of serious conversations about strength at the same time as celebrating life together, and a lot of color and fun engaged with that. And so that might be one example of a school that took it beyond the walls of their school to really engage the entire system of their community to really shift the narrative towards strength and resilience. Yeah.
How do sources of strength engage youth and adults that are part of particularly challenging environments, such as juvenile justice system or schools in high poverty communities?
Yeah, that's a great question. Sources of strength really grew out of communities that had high levels of poverty, that were under-resourced, that had historical trauma, that had difficult populations to work with, that were at high risk, so-called. And so at its core, Sources of Strength was always really designed to be a model that didn't have to function on, just the primary mental health referral process. And a lot of suicide prevention in particular is highly dependent on whether or not you have healthy, functioning mental health services. And we know across the United States there's a lot of mental health shortage areas and rural areas and highly traumatized populations. And so mental health is one of the pieces on our Source of Strength wheel, but we also try to broaden that to give people agency to tap into the kinds of strengths that lead towards health and well-being, even if in spite of the lack of mental health services they might have available. And so a lot of times it's whether or not we get invited into those communities to work, and then to help offer our model in a way that can really be practical for our most underserved, for high-risk populations to be able to access it and be able to tell their story of strength. For example, we had some partners do a Source of Strength training in a juvenile justice center in Idaho, and at the end of the training, a young man stood up and was visibly angry and said, "Why has no one ever told me that I have strength? Looking at this wheel, I have a really tough family environment, and I've always thought that's why I'm in here, because I didn't get a good family like everyone else. But when I look at this wheel, I realize I have so many other strengths in my life, and when I get out, I know that I can tap into these to really overcome challenges in my life." And so I think that was a really practical story of a young person in a tough situation, which had been telling a story about himself that had been limiting. The simple practice of the wheel had opened up his perspective of himself and shifted his self-narrative and internalizing those strength stories, giving him agency. And so that might be on the practical level. At the system level, we help to empower adults to create spaces for that kind of transformation to happen in young people's lives. One, by engaging lots of diversity in our peer leader teams. We don't just want the, kids that have it all together and are high achieving. We might want some students that are typical leadership style students, and then we want other students that the experience they bring, their experience of reality, that they bring that to a program to really contextualize it, to say, hey, what's going to work for my peers? And so I think that's a key to answer the question of what you're saying, is that we're empowering young people to make this program fit for the population that they come from, not just adults sitting in a room dreaming up of what's going to work, but really giving young people the tools to contextualize it for their peers, whether if it's students experiencing homelessness, what's going to work for them, what's going to have traction for them to develop resilience and wellness in their experience of reality. If they're in a juvenile detention center, what are the things they're using in that space, given the constraints and realities of that, to get through each day, and to help people shift the lens from I'm just a problem to be solved, or I'm at a deficit, or I grew up in poverty, towards in the face of this, I have become strong and resilient. I have overcome many challenges, to tell that story about themselves, and then to share that and spread it and make it contagious amongst the peers around them. So I think that's a couple of the ways we're getting at what you asked there.
Anything else you'd like to share about lessons learned along the way?
Yeah, it's a great question. I think we are continually learning and try to have organizational humility, that we as a program are really excited about what we're doing and believe it's making an impact, and hear stories all over the place. But we are constantly blown over by the reality of the things that young people are doing in schools and communities that we could have never dreamt up. And so having some humility to learn from the communities that we work with of what's working, what's not working, and to take the ideas and effectiveness of certain communities and then be able to spread that nationally. And so we're really excited about all the kinds of partnerships that we've experienced and the ways in which we see young people developing agency and using their voice in powerful ways to shift that narrative around risk, around well-being, around school safety. And we see this, for instance, to students who experienced the tragedy in the Parkland shooting that took place at a school. We see young people using their voice, standing up to shift the conversation around just tragedy and what happened to us and the risk that we're at, towards we can make a powerful impact and change around this, and we're not going to stop until we do make those changes, that we all can come to school feeling safe and secure. And we really feel that is key, that young people need to have a voice in this, that the absence of mental illness is not the goal, right? That's not what health is. We get to health by really celebrating life and not just surviving, but thriving. And so we're learning every day from the young people we have the opportunity to work with, from the adults and school systems and communities that are really doing good work to help benefit the health and well-being of their students. And so, yeah, I don't know if there's anything specific beyond that, but we're learning a ton on a daily basis from all the young people we work with. And so thank you for giving me the opportunity to share some of our successes as well as some of our philosophy and what we're learning. I hope it might benefit others who are out there on the ground, because it's not really programs that save people's lives or lead to health. It's the relationships and human beings that they have surrounding them and all the support systems that really lead to health and well-being. And so a program like Source of Strength is really just designed to be a conduit of that love and care and relationship that adults and young people are sharing to benefit the health of us all.
Great, thanks. On behalf of the Office of Adolescent Health, I want to thank you for joining us to learn about OAH and TAG and to hear about Sources of Strength. A special thanks to Dan Adams for sharing their work with us today. The TAG effort continues, and we invite you to get involved and spread the word about TAG within your professional networks. Here are a few of the things you can do. Explore the website, check out the updated TAG playbook, join TAG and get email updates, watch one of the TAG Talks videos with your colleagues, notify your colleagues and grantees about TAG, encourage your organization to use TAG action steps and resources, blog about TAG using sample text from our TAG toolkit, ask questions, share ideas, stay in touch, and use TAG social media tools to reach some of America's 42 million teens and the adults who care about them using hashtag TAG42mil. Here are some ways that you can connect with us at OAH. Visit our website, follow us on Twitter, following @TeenHealthGov, read our e-updates, and check out our YouTube channel. Thank you for giving us the opportunity to share TAG and a great example of TAG in action with you today.